thank you to the good chair of public health, the good ranking member, and actually all of the members of public health who have endured me talking to them about this bill and this critical issue for many, many weeks now. This has been about 2 years of work that I couldn't be more happy to be bringing before the full chamber today. We convened a working group through MAPOC's subcommittee on women and children, and I just want to recognize my co-chair, Amy Gagliardi, who herself is an IBCLC for over 30 years at an FQHC, serving the most vulnerable women and babies in our state, and we couldn't have done this without her. Similarly, we had the state chapter representative for the American Academy of Pediatrics, the state chapter representative for the American College of Obstetricians and Gynecologists. We had a representative from Marchant Dimes, 5 IBCLCs in total, research scientists from Yukon Health, many, many phenomenal and qualified professionals who came together to unanimously recommend the licensure of IBCLCs. IBCLCs provide clinical medical care for mothers during their most vulnerable moments. And for anyone here who has given birth or witnessed a loved one give birth, you know how important additional care, attention, support is during that time. And I'm so grateful that through this work, we will be able to take on the next step through hopefully our Medicaid work to ensure that this can be a service that our low-income mothers and infants can have access to going forward, because currently they are locked out of this support. And what that means is that our low-income mothers disproportionately don't begin their breastfeeding journey or drop out of breastfeeding, and that has critical public health implications, Mr. Speaker. As I have referenced before, but we'll just remind this chamber again, breastfeeding reduces hypertension, which is the #1 cause of maternal mortality. It also reduces infant mortality for all infants by 21%, and specifically for Black infants by 31%. Reduces the risk of type 2 diabetes in the mother, as well as breast cancer, ovarian cancer, and endometrial cancer. So this is also an opportunity for cost savings for families and the state as we reduce the incidence of those diseases. And lastly, I will make the point that as a state, for our low-income mothers, we do fund the provision of formula, as we should. But this is both a public health initiative to increase the health outcomes for our mothers and infants, and also will save when we can have mothers have a handful of visits with an IBCLC and not need formula for the next year, which we otherwise would be providing to those infants. And then to address the question earlier from my good colleague, there are other states, I think 1 or 2, who have a state plan amendment through CMS to allow for Medicaid reimbursement for lactation consultants, but that only happens for lactation consultants who are referred from either a APRN or MD, and that referral process is often not timely. At a time when, you have an infant that's feeding maybe every hour, every 2 hours, and you need help now. And also there is the concern about legal liability, and so in those states, the legal liability is on the referring physician. Licensure will put the legal liability onto the IBCLC. So I hope that answers the questions that were raised earlier, and I just want to thank you again, Mr. Speaker, for the opportunity to speak in support of this bill, and I urge my colleagues to support it as well.